The views and opinions expressed by the host do not necessarily state or reflect those of the hospital and its management. Furthermore, the views and opinions of the guests do not reflect those of the host, the show, the management, and the hospital. Lastly, no copyright infringement intended. All materials used and music background credit to the owner for public service purposes only.
Yes, good afternoon.
Good afternoon, hello quarantine. Welcome to Mental
Health Check. Take position, sir. Everyone.
Ngayong hapon.
Yes, and karong hapon, no, we are so blessed to have our esteemed guests to be with us right now.
Good afternoon, Dr. Ellen.
Duha sa pinaka-husgan sa Vicente Soto sa larangan ng health,
Yes,
be it physically and mentally.
mentally.
Parang there's a hidden patama there.
Yes, please help us welcome Dr. Oñate of and also Dr. Of course, forever slim, Dr. Helen Madamba.
Thank you! Nagbabalik!
Yes.
Nagbabalik ang Madamba sa Mental Health Check. Maayong hapon sa inyong tanan, mga ha-quarantine. And today, atong hisgutan ang atong topic karon, very applicable to the current events. Kay this morning, niabot na gyud ang atong COVID-19 vaccines nga Sinovac.
Yeah.
We have more than 7,000 doses for 2 doses each employee nga magpabakuna. So, I hope na ang tanan nga mga empleyado, frontline healthcare workers, mag-decide whether or not you will have yourself vaccinated. Dili ni
Pinugsanay.
pinugsanay. Walay pugsanay. So, you have to make your own choice. So, please be informed aron maka-decide mo kung mudawat mo sa Sinovac vaccine or dili. Kaya ang among goal ay to give it to those who want it.
Yes.
Kana.
And don't make ingon ba, with great choices comes great anxiety.
Ayos ka!
Good one.
So, I have seen a lot of messages. I have seen a lot of articles regarding apprehensions regarding the vaccine. So I think it's about time that we talk about it, since we have our very own resident sa Center for Behavioral Sciences in charge for our mental health, Dr. Oñate, to talk about it. And I also encourage our dear audience online that if you have questions, go ahead and comment on it, or you can DM any of us if friends does a Facebook.
Or you can also post your comments on our Facebook page at official VSMMC, or tweet it. We're also on Twitter at official VSMMC. And all of these
all of these will be, you can also replay all of our Soto Live at YouTube. Go ahead and key in Vicente Soto Memorial Medical Center. You just pop right up, and you can replay all of our episodes.
Yes, from Monday to Friday.
Or if you have pictures or videos, you can also email us, Ma'am Becca, right?
Yes.
Our email address is osm@vsmmc.doh.gov.ph. Memorize. Kailangan memorizing yan.
Wala pa. Hindi pa
Okay.
na-memorize.
Ayan. So today, our topic would be Give It a Shot. Most common anxieties on COVID-19 vaccination explained. And we have here Dr. Oñate. What is your motto in life, Dr. Oñate, as far as COVID vaccination is concerned?
As far as I'm concerned, I want to say get the vaccination, regardless of whatever vaccine you want, because why be a zero when you can be a hero?
Wow! Galing, di ba?
Very direct, di ba?
Yan.
So we now know where he stands.
Yan. Oh, very good, no? So whatever COVID vaccine it is out there, it's better to be a hero than a zero. Right? That's
Thank you, Doc.
a nice way of putting it. See, Dr. Edsel Salvano was telling us yesterday,
Yeah, I saw the
yesterday,
Yeah,
no?
yeah.
Oh, that the best vaccine is actually the vaccine that's already
Already
available.
available.
Yeah, because tomorrow you can actually have COVID infection. The COVID vaccine that you want might be a day too late.
Yes, and I also encourage everyone who's making the decision. You can actually just listen to yourself. Refrain na lang from asking other people's opinion because in the long run, it's your own body.
And it's your own choice.
It's your own choice.
Yes.
Oo, Ma'am Becca. Meron ka din bang motto in life when it comes to COVID vaccination?
So don't be scared.
Ah.
It's already there.
Yeah, oh, yan. Oo. Yeah, so in terms of, speaking of COVID vaccination, no, so we will have our ceremonial vaccination on March 4. And we have here with us a very special and very important person because you don't get vaccination if you
Without
don't
them.
have a
Yes.
vaccinator.
Oh my, the chosen one.
Yeah. Oo, the anointed one.
Anointed.
Anointed one.
O, diba? So, ang dami siguro anxieties ng anointment. So, here we have today with us in the studio, no? The team leader of the vaccinator team, Miss May Gokotano. So, she will be vaccinating the first individual who will receive the Sinovac COVID vaccine in Central Visayas.
Yes.
That will be our medical center chief, Dr. Gerardo M.
Aquino.
Aquino
Junior.
Yan. So, Ma'am May, good afternoon. Okay.
Hi, Ma'am Grace. Good afternoon, and thank you guys for
Hello.
giving your time to be here.
Hello, good afternoon.
Oh, Ma'am May, why don't you tell us a little something about yourself?
Resume.
I'm a mother of 3 and married to a responsible and handsome husband.
I would like to
Say
see the
hi, say hi.
husband.
He must be
Say hi
watching
to the
now.
husband.
Okay. So, Mami, let's get right to it. Unsa may mga pagpangandam nga imong ginabuhat,
How to
yeah, like imong gipangandam sa imong self mentally. Kay ikaw ba ang first jud na mo inject sa vaccine?
Pressure ba? Pressure.
Pressure?
My pressure.
And to think that it's the head. It's our head.
It's your
It's your head.
Sa tinood lang, no, wala ko na pressure nga mag-inject kay naanad man sad ko anang mag-inject sa. Pero ang ako lang gika-pressurean kay kanang mga like this one. Mo'y number 1 nga anxiety na ako.
Okay.
Maka anxious na ako. Pero kanang
We were just talking about that.
pero dili man sad ko kanang I'm prepared man ko always because of my years of experience as a vaccinator and immunization nurse diri sa Vicente Soto. Kay bawo ko nga ready na ko anytime kay kanang attend ako mga seminars, trainings, and kanang dili na ko mahadlok kay kabaw na ko anang cold chain management, how to inject properly, the preparation. So, I'm confident.
Have you, I'm
Lako.
just curious, Doc, ba? I would like to ask Mami, have you seen na the vaccine?
Not yet.
Not yet.
Mm-mm.
But they have arrived na daw.
Yes, ganiha.
Have you seen the other people na first in their countries na nabakunahan?
Wala ko nang tanaw do.
So what you don't know can't hurt you. No, kasi there was a president of a country, ang Secretary of Health nila or Minister of Health nila ang nag-vaccinate. And nakafocus sa kamay niya yung camera. So when he was injecting to the president, ang hands niya was really trembling.
That's
so, talaga-
nerve-wracking.
Yeah, oo. So that's
Pero
it. No?
Ang technique mo na dok, dili na mo i-think nga naa ka sa kuan kanang si Dr. Aquino ni akong injekan. Kaya naka-try naman ako sa sa personal lang nako nga life to ka kay kanang akong mother before kay na ICU man unya. Ako jud ang nag-care, nag-suction. Wala na ko gi-think nga ako ning mama, nag-think ko nga ako ning patient na kinahanglan ako atimanon.
Okay. Oh, sabi
She
ni...
has come prepared.
Yeah,
Spoken
so...
like a true nurse.
Ah, very good. Congratulations.
A healthcare warrior.
Sinabi ni Ma'am Ann, no, haha, Indonesia yan, Doc. Okay, so President of Indonesia, yung na-vaccinate, and the Minister of Health was really trembling. So at least you are so well-versed with your function that even with your eyes closed, but please don't close your eyes, ha? Oh, you can do it. Okay, that's good.
This is not the doctor.
So Dr. Onyate, do you have any advice that you can give to Ma'am May?
We were really talking about it earlier about performance anxiety and people trying to come up, and especially with a big hoopla, the cameras are on you. People actually make that feeling they get scared, heart rate goes up, breathing goes up, they start getting the quakes in the hands, and then they feel very ambivalent about what they're feeling. Now, what I told her even earlier when we were talking about when she wanted to come up here and she was feeling a bit scared. If you don't mind, no, I was explaining that you remember the first time you actually saw your husband, your first love. Diba, it's the same feeling. Your heart rate goes up, breathing goes, you get the shakes and all that. It's recognizing that it's the difference between recognizing the feeling and giving it a name. Instead of being scared, you can actually recognize it as excitement.
Excitement. Yeah.
So, and if you look at all the Olympic athletes, when they ask them whether they were scared competing, they will usually say, I was excited. So that they can feel better.
Yes.
Oo. And meron din before, no, meron din Miss Universe was asked, no, I don't feel any pressure now. Ano yun? There was somebody who
Convince
answered
yourself.
like that, no, but you could clearly see that they were trembling, no. I don't feel any pressure right now, no, but they were trembling. They're anxious, no. It's okay to be afraid, no. But we
That's right.
have to make sure that we do not allow our fear to paralyze us.
Agreed.
Yan. And
Nice
if
word.
you're riding a bicycle or even a motorcycle, no, the way to keep your balance is to keep moving forward.
Galing.
Just keep moving.
Oh yeah, just keep
Just keep
moving.
walking. Johnny
Just
Walker.
do it.
Just do it. Parang
Oh,
Nike commercial.
yan. Okay, so palakpakan naman natin si Mami.
And natin cheerleader, Mami. Go, make
So,
Clarice Kokotano.
ayan.
Ate Elden.
Oo. So, Mami, na kay motto in life for our mga quarantine na nagduha-duha pa sa
Inject.
pag-receive sa Sinovac
Pagkatusok.
vaccine.
Yes.
Oo.
Duha kong motto in life karon sa
yeah.
pagpakuna.
Yes.
First kay just believe so we can survive.
Wow!
Galing.
Ano yung pangalawa?
The other one is it's better to have a little of something than having nothing at all.
Yan! Okay! Thank you. So, better
Well spoken.
something than nothing. Very good. So, thank you. Meron kang gustong batiin?
Ako mga child survival family.
Wow!
Papa Ilaya.
Thank you.
Okay.
To you once again, ladies and gentlemen, Ma'am May Clarice Kokotano, our
Yan.
vaccinator.
Thank you very much po,
Thank you.
ma'am, for facing your fears of public speaking. Questions that we received
Yes.
from our healthcare workers who expressed their anxieties over COVID vaccination. And I'm glad that Dr. Onyate is here so you can address all of these anxieties one by one.
Okay.
I'd be glad to.
Okay. Can you ask the first question, Jared?
Yes. On conspiracy theory, Doc, do we really need the COVID-19 vaccine? Merong theory na may nanochip daw.
Nanochip.
Nanochip.
for monitoring our every move. So I think this is from conspiracy theorists. mostly.
Yeah, I actually looked into it, no, and the whole thing about that nanochip was blamed on Bill Gates. And
Yeah,
that
for
there
the
were,
Moderna.
Yeah, for the Moderna vaccine, and there were 48% of Republicans that actually believed that it was true, but it was deemed false, and there is no such a thing that the nanochip was part of the vaccination, na liquid or the syringe that was going in. but it was part of it. The back part of the syringe, there was a chip to actually gather data on the actual vaccination batch so that you would know kung saan siya, who got it,
Na-deploy.
yeah, saan siya na-deploy. But that was only
okay.
it.
So it's basically tracking of the vaccine.
Yeah, it's just basically tracking the vaccine. It wasn't even tracking the person that was being vaccinated.
Only the vaccine, up to the syringe only.
Yeah.
Speaking of nanochips, di ba supposedly mas larger yung needles when it comes to nanochips? And have you seen our needles vaccine? I don't think a nanochip will fit.
Actually, there's a part of a study being done now about nanochips. It's not really a nanochip, but more like they use it for nanoviruses that they actually want to target cancer and to cure cancer. But it has no tracking ability. It's not part of what we do now. It has nothing to do with the vaccine. It's about treating cancer.
Treating cancer.
So clear na ha.
Yeah.
Walay tracking device ang vaccine.
Oh.
Yeah,
Okay.
wouldn't that be amazing? Because even if it had there that you could actually become a superhero, may
Oo nga, no? So,
Sayang.
An injectable tracking device.
Oh,
Para
diba?
sa mga paranoid girlfriends and boyfriends.
agoy.
wife and husband.
Wives and husbands too. Matakot na kayo.
Takot ang mga husband.
Be careful.
Okay, sige. So, mga ka-quarantine, no nanochip, no tracking device in the COVID vaccine. Oh, correct.
Definitely
Sige.
not.
So,
Yeah.
Ma'am Becca.
Yeah, second
sige.
question is anti-Chinese sentiment. So, dati sabi ng Pfizer, dadating na COVID-19 vaccine, tapos today, Sinovac na naman. So, di kaya maging Chinese na tayo pagkatapos mag-injection ng Chinese DNA?
You actually.
I think that's ano, from a meme ng
Oh, it's on
TikTok,
TikTok. Yeah,
na the
that's a
vaccine
TikTok,
siya. And then suddenly she started talking
Talking in
in Chinese.
Chinese,
Oo.
yes.
Yeah.
That actually does not exist. It's just funny. But I understand that there's an anti-Chinese sentiment. But you can actually look at it in another way, no? And this is adding to the conspiracy theory. If it really actually ended up starting from China, wouldn't they be the one having the best vaccine to treat us because they started in the first place?
Yeah.
So why would you go anti-Chinese? Now they even know what they created, so they know how to stop it.
Yeah.
Yes.
Also, may message dito si Irvin Earl Arcia.
Celia.
The key for vaccine acceptance is through rational thinking and having an open mind. Stereotyping and prejudice will not bring us any good.
True.
Okay. So you have to believe the science. You look at what is scientific, what is factual, what is based on evidence. And that leads me to the next question that has been asked several times,
Yes.
no? 50% lang efficacy ng Sinovac. Does that mean, or ibig sabihin, 50-50 lang chance na ma-prevent ang COVID-19 infection? Baka naman tayo maging 50-50.
Okay, let's be clear. You really need to look into the science, guys, because if you really look into the science, you'll actually find out that 50-50 thing is not accurate. No, if you look at the Brazilian study, it actually went up to 94%. Then some of them said 74%. Some of them, that was the efficacy. And efficacy, if you look at the science also of it, depends on how you actually define efficacy is different from one nation to another. So it's not a hard fast rule. The bottom line is this: if you want to get vaccinated, the vaccine that we're getting, the Sinovac, has 100% from you getting the severe and not dying from it.
Yes.
It's 100%. You might get the severe, but you will not die from it.
Yes.
So the point is, if it's effective from not dying, 100%.
It's basically a cure.
Yeah, it's basically a cure to some extent. I'm saying that it's better than nothing, guys.
So
You should get it.
COVID-19 will just be like your usual cough and cold.
Yes.
Flu.
Or flu.
Or flu.
Right? It's the
Hindi ka
same as
mamamatay.
getting a flu vaccine, so that even if you do have flu, you don't die from it.
Yep.
Huh? Because basically what we're afraid of, the reason why COVID is such a big deal is because it can actually claim lives.
That's
And
right.
there's, I think, almost 12,000 already that have perished in the Philippines because of COVID infection.
Yes.
So it's important that we stop these mortalities due to COVID-19.
Kumbaga, softening the blow.
Yeah, it's
Flattening
softening the
the
blow. It's
curve.
flattening the curve.
Yeah. So there's a question here na how do we overcome public distrust to achieve herd immunity through vaccination?
Kanino question yan, Ma?
Kay Rafi.
Rafi Rueda. Related?
My son.
Okay. Sige, let's answer your question. Public distrust to achieve herd immunity. Siguro first thing, I think we need to explain what is herd immunity. Herd immunity, like most of the vaccines, we cannot give it to children, right?
Yes,
Cannot give it to
older,
children. Kasi 18 years old and above.
Yeah.
So if you imagine you have a child in the family and everybody gets vaccinated, now there's a less chance that that child will get the infection,
True.
right? Because everybody else naka-shield sila, may
Yeah.
shield. So even if that child is not vaccinated, but that child is now protected from that infection because everybody else is injected or is vaccinated. So that's herd immunity. This is the reason why we need to vaccinate up to 70% of Filipinos to stop COVID in the Philippines. Yeah. So it's a personal choice, it's a personal responsibility, but it also affects the whole community. It affects and it saves those who are vulnerable. Because even if we are young, well, we are young, okay? Even if we are young, we are healthy, no? Even if we get COVID, it's fine because our immune system can probably take it. But our parents and our grandparents probably will not. So by getting vaccinated, you are not just thinking of yourself, but thinking of those who are
Around
vulnerable.
us.
Can I add to that?
Yes,
No?
yes.
About herd immunity. People talk about herd immunity. One of the things I just want to emphasize about that, no? Think about your loved one. If you don't want to do it for yourself, think about your loved one. You're not just trying to protect yourself. You're trying to protect the people you love. You get the shot, you get whatever vaccine, and you stop them from dying. I have had so many patients right now who have remorse of their health workers, and they realize that they brought the COVID back home.
Okay.
So imagine if they were vaccinated. That's a whole bunch of guilt you don't have to refer back to.
Yes, okay.
Look, another question. Is VSMMC being coerced to get vaccinated with Sinovac, which is not the best COVID-19 vaccine? And why are we settling for the second best or third? May kickback ba ang government officials, Chan? So this is talking money-wise, I
Yeah.
guess.
Corruption.
I guess, Madam ba?
For me? Let me just clarify, no? The Republic of the Philippines received 600,000 Sinovac doses, and this was a donation. This is a donation. They did not spend a single peso. So I really don't know how we can think that it's part of corruption because it was a gift.
Yeah, and we also it was I saw the news last night. It was actually proclaimed by Dr. Duterte. He actually thanked China for. He also thanked
the
China for
donation,
donating and
yes.
also for transporting the vaccine themselves. So instead of
Oh,
us
yeah.
flying there to get the vaccine, China sent their aircraft.
We're the only country
Yeah.
We're the only country
Yeah.
to have that kind of privilege.
Yes.
Yes, oo. So, talking about medical eligibility, no, meron akong maintenance. I have maintenance medications for high blood, hypertension, diabetes, renal disease or heart disease. Can I get the COVID vaccine? Is it safe for me?
Yeah, it's actually safe for you. We looked into the contraindications for it. No, was about 60 years old, and hypertension was not part of the contraindications as far as I know. No, and you can actually get the Sinovac vaccine because it's safe. Like I said, 100% of not being dead is 100% of not being dead. So you get it. That's the best indication as far as I'm concerned.
Oh, okay.
Actually, it was really explained yesterday by Dr.
Yes.
William Moore
Mm-mm.
that getting the
Oh, kasi for any intervention, kinahanglan you weigh the benefits versus the risk.
Yes.
And
Agree.
we're talking about frontline healthcare workers. Kada adlaw mo tan-aw sa mga pasyente nga naay COVID-19, no? So kung mo gira sila sa COVID-19, kinahanglan na sila ibala.
Yeah.
So ang atong bala, aside from our PPEs and our safety protection, our standard precautions, this is an additional weapon, no? COVID vaccine. So even if you are, if you have comorbidities, even if you're pregnant but more than the first trimester or lactating, you have to weigh the benefits. These benefits outweigh whatever risks there are.
Yeah.
Yan. But again, no, why pugsanay? It has to be a personal choice because you're the one taking that risk.
But
Okay.
as long as it is controlled,
Oo.
your diabetes,
Yes,
your
it has to be
hypertension,
controlled.
yes.
Oo. So, talking about risks, no, pwede mangyari yan. Severe na allergy, pwede kamatayan. It's what is called anaphylaxis.
Yes.
So, napulbaan ko kung mag-anaphylaxis ko, Dok.
Actually, if you saw the rollout yesterday,
Yeah.
dalawa lang yung nakita ko sa TV, no? That had a reaction. One was this girl who had rashes, and then one was this guy who had a predisposing hypertension and apparently triggered, but they can't really say that it was caused by the Sinovac.
Yeah.
But either way, if you look at the science of it, you shouldn't worry about anaphylaxis that much. Why? Because lahat, when we're doing the vaccination, no? Number one, you have 30 minutes to an hour post-vaccination that we will monitor you. And then on the second part, we're still continuing to monitor you. Even if you're outside, we're still monitoring you.
For up to a year.
Yeah, and all the doctors, even the most basic doctors, ako nga, psychiatrist, I know how to treat an allergic reaction like anaphylaxis with one, either an EpiPen or an antihistamine if need be, no? The idea is we are prepared, your teams are prepared to take care of you should something ever happen. That's the point. So don't worry, if something should happen, we can take care of you.
Okay. So that's
Yes.
our commitment. BSMMC is ready.
Ready
Yes.
for
We're ready for
any
anything
reactions.
that will happen. Okay. Oh, so naay mga job order nga nag-ingon, no work, no pay kami. Baka manghina sa COVID-19 vaccine and dili mi katrabaho.
We discussed that, di ba,
Yeah.
Doc? That we're actually taking into consideration what happens to you. If something should ever happen to you, it's taken into consideration that we will still take care of you because we're BSMMC family. So we will take care of you.
Okay, sige. Naa pa, baka lalo ako magkaroon or mahawa ng COVID pag nagpabakuna ako.
Actually, the point
I'm gonna go
of
on
the
that.
vaccine is to protect you.
Okay.
Yeah,
So-
you guys have to understand that the reason that you get vaccinated, okay, let's look at this in very simple terms, no? Look at our children. Diba, it's even required by law that we vaccinate our children so they don't get measles,
Vaccine-preventable
it's
diseases.
preventable diseases are so many that we do. Polio, which actually Sinovac is actually based on, no?
Okay.
How we don't see polio as much as we seen it in the 1970s, 1960s. Practically, it's off the map, no? And it's even been declared that it's been cured. Imagine if we can do the exact same thing for
oo.
COVID.
Correct.
So, nasa
Okay,
diri,
Oh,
pain.
legitimate.
Masakit daw ang injection. Takot ako sa tusok.
Ako din.
It's okay.
Ako po.
It's a short span lang. Tapos it's not really
Yes.
sakit. It's uncomfortable siguro.
Oh.
Actually, I'm a nurse, so I've been a practicing
Oh, yeah.
nurse in an ER in the States for the longest time, for like 5 years now. The point that I'm saying is this: I actually have a hack. It's a mind hack that I use on my patients when we inject. It's up to you. The point is this, and listen carefully. When you inject somebody, you ask them to cough at the same time. So when they cough, of course they're not coughing like that, you know. Cough, stay in place, but cough is the time you inject.
Inject.
The same time you inject, they barely feel the needle going through the skin.
Power of
Mamay,
diversion.
Ikaw magbakuna sa akin, ha?
Pero Doc, digit sila
Doc,
digit sila mahadlok Doc kay our vaccinators are experts.
Super
Oh,
experts.
diba? We have si Mami, si Mami here.
They're
Nakatawa pag
experienced
yun yung
nurses.
sakit.
Yes.
Nakatawa si Mami.
O ganit letig bakuna sa atong mga
Oh.
gagmayng bata.
Yes. So, thank you very much. I think that basically wraps it up, no? There's a comment na baka kung magpa-vaccine ako ng Sinovac, hindi na ako in at ma-discriminate ako sa amin. Actually, that is the same way with those who get COVID. But slowly, no, little by little, the society learns to accept that COVID is part of our lives now and we have to learn to live with it.
Yes,
And
the new
getting
normal.
vaccinated is one way to live in the new normal. Yan, okay. So do you have any other additional messages for quarantines?
If ever you get anxious about getting the vaccine, no, remember one thing. If it's born out of love and you're trying to help and protect other people, the community, the nation, don't you think it's the right thing to do? So get yourself vaccinated. It's up to you. It's still your choice. We are just trying to give you the best options that we can actually give you. And whatever's here, we will provide so we can protect our loved ones.
And I know there are a lot of questions coming in, no, from our dear audiences, and sad to say we are running out of time. So we will be tackling them on the future or FB Live.
FB Live.
So,
So keep the comments
so keep the
coming.
comments coming in. We
Yes.
will be tackling them. Don't worry. We will be answering all of them. So just just tune in every 5 p.m. Dili ta mo undang
Yes.
o educate regarding the vaccine until tanan tawo
Bakunahan.
ma-enlighten
Yes, ma-enlighten.
about
All
the
ans-
vaccine.
all questions answered.
Yes, because I know your anxieties come from not knowing the facts. my
Yes. And related to COVID vaccine, these are some of the messages of some of our healthcare workers. Please tune in.
Every day I go to work, fearing that one of these days I will test positive for COVID-19. Pfizer, Moderna, Sinovac, now is the best time to get vaccinated. Tomorrow may be too late.
Tinuod nga wala pa'y bakuna nga 100% effective. Apan kung ikaw, imuhang banay or ang kadaghanan sa barangay magpabakuna batok sa COVID-19, inubanan sa pagsunod sa mga public health measures or kanang gitawag nato og minimum health standards. Dili madugay nga ang Pilipinas makakabot sa kinatibuk ang proteksyon batok sa COVID-19 infection. So have yourself master listed and get yourself vaccinated. Together, let's fight COVID-19.
Magpabakuna ba ko sa Sinovac? My answer is yes. Una sa tanan, I always believe in immunization. Ang immunization usa ka strategy nga proven to be effective against fighting vaccine preventable conditions. Usa na niini ang COVID-19 kay doon na naman na-discovering bakuna niining sakita. Ikaduha, as long as ang bakuna FDA approved pasabot, it is proven safe and effective. Sigon sa naunang resulta sa ilang research, ang Sinovac vaccine magkaprotektar kanato og 50.4% against mild COVID, 78% against moderate COVID, and 100% against severe and critical COVID. So pasabot, if ever ma-COVID man galing ko later on and then ma-inject ka na ko og Sinovac, at least ma-COVID man galing ko, dili na severe. So, it's always a blessing whatever brands nga i-offer kanato sa mga health worker ato kining i-grab ang opportunity because this is one chance of a lifetime. Kaya we never know, ang ubang brands dili na moabot. So, basin magka-COVID pa ta, usa maabot tong atong gipaabot. So, as a health worker, magpabakuna kita. Kay kita ang kanunay exposed ni ining sakita. So, magpabakuna kitang tanan. So, see you on March 4 and onwards. para sa atong COVID-19 Sinovac vaccination. Daghang salamat.
Ay pug sanay, ang importante mabakunahan ta.
When I heard the news nga Sinovac di ay ang ibakuna sa atong mga healthcare workers sa Vicente Sotto, at first murag yung kog na hadlok kay when we say about Sinovac, it is produced sa China niya. Kabaw ko basta China since pagagamay pa nako nga murag kaduduhaan yun. At the same time, kato initial reports regarding Sinovac nga dili siya recommended for healthcare workers, but as we go along with the process for the vaccination, akong napaminawan, and until this time naagihapoy pagduha-duha, pero ako pong nadunggan sa nagkalain-lain nga mga eksperto labi na gyud sa Soto live nga debunking myths of COVID-19. Ako nakita nga siguro the best vaccine that you could have at this time of the pandemic is the one that is really available.
Yan, thank you very much.
Nice video.
Kani sila, ato ning mga influencers because they were brave enough na mohatag og video on their opinions and their encouraging statements on COVID-19 vaccination.
And I hope that our episode today has somehow shed some light on your apprehensions regarding taking the vaccine. And if you want to, for our dear Soto staff, be it nurses, doctors, or whatnot, and if you want to change your consent regarding your vaccines, you can go ahead and edit your responses on the emails that you receive. Pwede ragid mo yes or mo no, balik. Depende sa inyong choice.
Yes, and we have to make sure that we respond to the survey. Okay, this means you are interested in a COVID vaccine. It's fine to say yes, it's fine to say no, but you have to respond. Otherwise, this will mean that you're not interested in COVID-19 vaccination. So for those who say yes, we will be scheduling you for our prioritization list. Those who say no, this is the list from which we will get the numbers for other vaccines that may come in the future. So as soon as we identify the number of vaccinees in Soto, we will now give an opportunity for other hospitals in Central Visayas for our quick substitution lists. And we'd like to announce that we will be having our ceremonial vaccination on March 4 at the Center for Behavioral Sciences. And the vaccination of our Soto employees will immediately follow afterwards. So we will be vaccinating for 7 days.
So hopefully wala na yung magduha-duha na magpabakuna.
Yes, and again, your choices will make a difference regarding our statistics and makahelp sa na determine kung sa good voice sa kadaghanan. And again, your choices are relevant but they are not prejudiced.
Yes, agree. So we'd like to take this opportunity to thank our very impactful speaker, Dr. George Mario Ornelas.
Thank you guys for inviting me.
And of course, our very first vaccinee for Central Visayas. We'd like to thank our producer, our medical center chief and incident commander, Dr. Gerardo F.
Aquino Jr.
Thank you, sir.
And also, of course, we would like to thank you, dear guest, Dr. Madamba and Dr. Oñate. Salamat sa pagpaunlak ng oras to be here. And I know you guys are so busy, especially you, Doc, with the vaccines and all. But you still have the time to shed some light, diba, sa ato ang mga nagkalaghan ng queries regarding
service.
So I would also like to echo what Dr. Beverly Lorraine Hall mentioned yesterday, na the all thanks is really up to those frontline healthcare workers who have continuously and selflessly taken care of our COVID positive patients in VSMMC.
Yes.
Especially Dr. Reyes Ligaray with all of her efforts at the VSMMC Subnational Laboratory. That team has really made wonders in making sure that we have prompt results of our RT-PCR SARS-CoV-2.
Yes. So
and all of our partners, remember, we have a shared identity in Soto Live. In Soto, we have all of our partners in DOH hospitals, city hospitals, the DOH, our donors, our volunteers. Daghang salamat.
Yes, and mo kini ang episode karong hapuna. Ako din si Jared.
Ako si Helen.
George Hero.
I'm Becca.
Ano man, Ma'am Becca?
Dinis sa Soto.
Kalidad nga serbisyo, among karmo.
Daghang salamat.
Maayong gabi!